There we go.
There we go. So thank you so much, Anne. That was such a spectacular introduction. I am so honored to be here tonight and to talk with everyone. So I'm going to go ahead and pull up the share screen here. And I'm going to share this. So hopefully everyone can see that.
Yes.
And then great. And then Anne, can I ask you to go ahead and mute yours? Because I don't know that I'm savvy enough to get back to that screen. Okay, fantastic. So welcome everyone. I am here tonight to talk with you. Let me see if I can switch this here. About Functional Breathing 101. And again, thank you for that wonderful introduction. And thank you so much for Dr. Loud inviting me to do this tonight. I am just thrilled to be a part of it. What I would say is that if you are her patient, you are so lucky. She is the dentist that I would go to as a dentist. I would send my family to. She is just spectacular, looking out for your best interests. Such a thorough dentist, whole health, and I'm glad to know her. So a few things. I'm going to ask you to stay muted, and I think I have you muted, but in case I fumbled on that, just keep yourself muted during the presentation and then save your questions. I hope you will have questions, and we'll have a question and answer session at the end. So if you don't want to forget them, go ahead and put them in the chat or jot them down, and we'll unmute everyone at the end. So who am I? I am Dr. Casey Jones. I am a whole health dentist. I've been a dentist for 12 years, and I am passionate about prevention and education. I firmly believe that our oral health is part of our overall health and that breathing also affects that. I'm constantly sharing information on social media, so feel free to follow me at Dr. Casey Jones. I was a professional dancer before I was a dentist, and I met my husband on a national tour of My Fair Lady. And then later we traveled and performed together on cruise ships. I am also a mom. I'm a wife. I have 2 awesome kids who are 9 and soon to be 11. And the reason that I'm here tonight is because I'm also an Oxygen Advantage Advanced Instructor. So like Anne mentioned, I have trained under Patrick McCune, who I know that you, some of you have maybe read Close Your Mouth, because I know Dr. Loud often recommends that book, which is fantastic. And that's where I started with this. But he has other books which are also great. And one of those is The Oxygen Advantage. And that's what led me to want to become one of his Oxygen Advantage instructors. So I've had 80 hours plus of training with him, and he's just fantastic. He's a breathing expert in Ireland who's been doing this for 20 years and just a wonderful person. So before we get started, I just want you to notice. I want you to notice how you're breathing, and I don't want you to change anything, and I don't want you to judge it. So right now, are you breathing through your mouth? Or are you breathing through your nose? Are you breathing up in your chest, or are you breathing further down in your belly? Can you hear your breathing? And are you breathing fast or slow? I want to ask you some other questions. So do you snore? Do you wake up with a dry mouth? Do you toss and turn or wake up several times a night? Do you wake up feeling unrefreshed? Do you have trouble falling asleep or staying asleep? Do you wake up with a headache or a neck ache? Do you clench or grind your teeth? Do you have GERD or acid reflux? And do you have frequent trouble with sinusitis or a stuffy nose? The reason I'm asking these questions is because these questions are often associated with sleep disordered breathing. And sleep disordered breathing is a range. So we always think of sleep disordered breathing as sleep apnea, and we think of the older male, overweight, and that's it. But that's not it. It is a spectrum. So in sleep disordered breathing, we start with snoring, which snoring is not normal. So I'm not talking about you're just sick, you have a cold and you're snoring, you're stuffed up. Any amount of snoring chronically is not normal. That is a sign that something is obstructed and things are flopping around and you're having trouble breathing while you're sleeping. As you continue up the spectrum, you can have upper airway resistance, which is where you're having trouble breathing all night while you're sleeping to the point where it's causing you to wake up and never get a restful night of sleep. This is much more common in young, fit females. Then you go on to obstructive sleep apnea, and you can have mild, moderate, or severe. Now, there's also insomnia that's mixed in there, and that can go with obstructive sleep apnea or be on its own. But if you can imagine, sometimes if you're having trouble breathing while you're sleeping, why would your body want to let you fall asleep? So sometimes it's a defense mechanism that you know that you're going to have trouble and be choking while you're sleeping. And so your body tries to keep you awake. You can also be off balance with your cortisol levels and your adrenaline and kind of living on those hormones. And it's really difficult to shut your mind down and be able to relax and go to sleep. So sleep disordered breathing, this right here is a fantastic book. I love books. The 8-hour sleep paradox. And these are some things from it. So about 42 million Americans have sleep disordered breathing, or up to 90% of those are undiagnosed. So some of the most common groups of people with undiagnosed sleep disorders are athletes, allergy sufferers, children with ADD and ADHD, petite women, and people who grind their teeth. Their sleep disorders aren't caught because we aren't looking for the early stage symptoms. And so they are falling through the cracks of the healthcare system. And the bottom line is that even if you're healthy, you could be a ticking time bomb if you're not breathing well during sleep. So this is one of the things especially that drew me to the oxygen advantage part of breathing, because it's not just the people who are sick that are having dysfunctional breathing. It's sometimes elite athletes, it's very fit people. And so if we focus on our breathing more, we can become healthier, and it's exciting. Sleep disordered breathing is an insidious inflammatory disease that affects every system in the body. It's associated with the biggest killers in the Western world: high blood pressure, strokes, heart disease, Alzheimer's, diabetes, and even depression. This shows some of the things that are associated with sleep disordered breathing. So you have GERD, asthma, you can look through this list. There's a lot on it. And one thing to note is that 80 to 90% of people with diabetes have obstructive sleep apnea, and 50 to 90% of people who have had a stroke also have obstructive sleep apnea. So in addition to the health concerns, we also have the oral health concerns. Dentally, you're looking at more tooth decay, you're seeing more gum disease, you're seeing signs of clenching and grinding, and I'm also seeing acid erosion where the teeth are dissolving, because you often see GERD or acid reflux going hand in hand with sleep disordered breathing, because as we're trying to breathe harder, that diaphragm is in pressure is sort of pushing that acid up. So we see those go hand in hand. The other thing we see is our mental health. So depression and anxiety go hand in hand with sleep disordered breathing and with dysfunctional breathing. And I wish that it was something that was recommended more often when we see signs of anxiety and depression, to have people have a sleep study and see if that is playing a role, because that might be part of why they're suffering from the anxiety and depression. Breathing is the single most important immediate physiological activity that we all must do to live. If you force your brain to choose between sleep and breathing, breathing will win every time. It was never meant to be a competition. Sorry about that. Let's see. The body needs oxygen more than any other nutrient. So this is also a fantastic book. It's by Dr. Stephen Lin. And you can go weeks without eating, you can go days without drinking, but you can only go minutes without breathing. And you breathe 20,000 times per day. Thank goodness it's automatic and we don't have to think about it, but we can think about it, we can control it, and how we breathe affects our overall health, our oral health, and our mental health. So why in the world is sleep disordered breathing so common? That has to do with evolution and epigenetics. So straight teeth used to be more common. We had a harder diet. So as our diet became softer, the Western diet, our jaws weren't working as hard to chew our food. Everything started to develop differently. We no longer have room for our wisdom teeth. Our jaws are growing smaller. So instead of seeing these nice straight teeth, we're seeing more crooked teeth, more crowding, and we are seeing that we are growing just to be smaller with our skulls are literally just smaller than they used to be. So we have less space for everything else to be. And as we have less space in our jaws, we have the same amount of teeth that are trying to fill that space. And so they're coming in crowded. As our brains got bigger, we also lost some room for our sinuses. And so it became harder to breathe. We switched to mouth breathing so that we sometimes allergies became a factor. We moved inside, we were more sedentary. That's a lot that went into it. So the genome hasn't changed, but epigenetics refers to the environmental impact on the genes that are there. And so there have been some studies by Dr. Robert Corricini, for example, where he had places where Western diet was not introduced yet. And when it was introduced, within one generation, 50% of the population had malocclusion, which is a fancy way of saying a bad bite. There was crowding and jaw discrepancy. And within 2 generations, 70% had a bad bite. And within 3 generations, 85% did. So the crowded teeth and stuff, it doesn't take a long time to see the change in the skulls and the jaw. So as we're breathing through our nose, as we're breathing through our mouth, we want to be breathing through our nose more than our nose. We are seeing changes because as the jaws open, it affects how everything develops. So if our tongue is down in the floor of our mouth instead of up in the roof of our mouth, we're going to see, instead of this beautiful U-shaped arch that as a dentist we would love to see, which is also the floor of your nose, and it's nice and wide so you can breathe well, we see these V-shaped arches. We also see these longer faces. I'm going to go back. We see longer faces. We see the jaws being set back. And all that, again, is how we're developing. So the exciting thing now is now that we know that, we can help guide the growth of children. But we didn't know this before. So there's a lot of us who have developed like this, where we are seeing the chin is often set further back from being open. So it didn't grow down and forward like it usually would before from being mouth breathers. And with that growing back, we have less room in our airway, because as the jaw is set back, instead of having this beautiful garden hose to breathe through here, we have this little straw that we're still trying to breathe through. So we're growing smaller airways from the beginning. And as that jaw is set back, we are impacting that airway, making it even smaller. So a lot of times what happens is, especially as kids, but it becomes a habit, the chin will be tipped up, almost like CPR, to be able to breathe, but then you can't see. So then you have to bring your head forward. And as you bring your head forward, you get that forward head posture to level the eyes. And that can be very taxing on the neck muscles, because imagine holding an 8-pound bowling ball in your arms all day. That's essentially what you're doing with your head when you have that forward head posture. You're using a lot of muscles to hold it there. So this is what I see every day. I see narrow arches. I see crowded teeth. I see decayed teeth, because crowded teeth are harder to keep clean. And if you're breathing through your mouth, you're going to have a drier mouth that's going to make you at higher risk for having cavities. I see gum disease and gum recession. Again, with that drier mouth, breathing through the mouth, you're going to see more of this imbalance between the bacteria and more gum disease. I see acid erosion. So the arrows are showing where the teeth are literally dissolving from the acid. And sometimes it's in the diet, but more often it's actually coming from us. And that's related to GERD, like I said, goes hand in hand. I also see lots of grinding. So I see signs of tooth wear. I see signs of chipping. I see these notches along the gum line here, where that's the same thing with clenching and grinding. It's where the tooth is flexing, and that's where it takes the force. And we see these notches right along the gum line. And I say to patients, we now know that grinding is often your body's way of opening up the airway to be able to breathe. And so you're sort of tipping that chin forward again, but the teeth get in the way. Beyond looking at the teeth, I also see in mouths, and here are tonsils. So if you're missing them or they're small, is plenty of room to breathe. But once those tonsils start to get big here, then it becomes even harder for us to breathe, and we already have smaller airways. So I say, have you been sick? And most of the time they say, no. And I say, well, do you breathe through your mouth or do you breathe through your nose? Because oftentimes if we're breathing through our mouth instead of our nose, we're going to only have our tonsils as our first line of defense to filter the air in any way. And they are going to be working overtime. They're going to get bigger. And then it's a vicious cycle because it becomes harder to breathe. So then you're more likely to be mouth breathing. I also look at this here, and this shows that here you can see in between, that's a nice, in my mind, open airway. I rarely see that. Usually I see these two on this side here. And I explain to patients that there isn't much room between the roof of your mouth and your tongue while you're awake. And sometimes that closes off even more while you're asleep. And so sometimes that's snoring, and sometimes that's even stopping breathing while you're asleep. And then I say, so you're at high risk for sleep disorder breathing. And then I was like, okay, that's not helpful. I just gave them all this information and I have no point of action to give them. So that's what drove me to want to become an Oxygen Advantage advanced breathing instructor and help people, because not everyone is going to be bad enough to need a CPAP, to need to have a mandibular advancement appliance, to need to have surgery of some sort. Some people, if we can establish the functional breathing during the day, we can help the breathing that's happening at night. And even if you do need one of those interventions, if you're not functionally breathing and you're breathing through your mouth, for example, a CPAP is not going to be as effective. So changing the breathing patterns and establishing nasal functional breathing patterns and correct tongue posture during the day can positively affect your overall health, your oral health, your mental health, and your sleep. Because it's not magic. If we fix something, if we reposition the teeth, if we expand the palate, if we fix the nose by doing surgery, whatever the case is, it's not magic that all of a sudden you know how to breathe functionally. It's become a habit a lot of times. And I think of breath retraining like physical therapy for the airway. So what is dysfunctional breathing? Dysfunctional breathing is mouth breathing. It's chest breathing. It's rapid breathing. It's frequent sighing. It's frequent yawning. So if you think about chest breathing, that's the sort of breathing that you do when you're scared, and it can cause some more anxiety, and it uses a lot of the muscles. So dysfunctional breathing is often referred to as over-breathing because we're getting plenty of oxygen, more oxygen than we need, but we're not using it effectively. And we're breathing off more carbon dioxide than we should be. And carbon dioxide, as we'll talk about, is not just a waste gas. So some others can refer to it as chronic hyperventilating because, again, you're breathing up in your chest and it's kind of like hyperventilating, but you're doing it all the time. You weren't designed to endure chronic stresses like we do. We were meant to run away from a tiger and have quick stresses. So what is functional breathing on the flip side? It is nasal breathing at all times. So the mouth performs 0 functions for breathing. The nose conditions the air for the lungs by warming it, humidifying it, filtering it, and disinfecting it. So the mouth is a hole. Other than that, it was never meant to be a place where you would breathe. You wouldn't drink or eat through your nose. So why would you breathe through your mouth? Your nose has all of these defenses to filter the air for your lungs. And in the paranasal sinuses, we produce a molecule called nitric oxide, which is a relatively new molecule that we've been talking about. And it is something that can disinfect the air. It's been shown to kill viruses, fungi, bacteria. It also acts as a dilator. So it dilates the airway, the sinuses all the way down. And it also is a vasodilator. dilator. So if we don't breathe through our nose, we don't get the benefit of that. Breath, I love books again. So Breath is a wonderful book by James Nestor. If you haven't read it, you probably should. And it is so great to learn about the nasal breathing from that perspective, because he purposely stuffed up his nose. He put silicone plugs in there so that he couldn't breathe through his nose, and then recorded what happened to his health, which is incredible. His cholesterol went up, blood pressure, apneic events, he stopped breathing while he's sleeping. It's just great to read and just so clear. And I love how he says that if you don't breathe through your nose, it's like turning your lungs into an external organ. So you're not filtering anything. You might as well just take your lungs and just plop them right on your skin. That's all you're doing. So first place to start, can you breathe through your nose? And if you can't breathe through your nose, or let's see, if you're not breathing through your nose, I should say, is it a habit or is it obstructed? Because if it's a habit, then close your mouth and start breathing through your nose. It's a habit though, so it's going to take a little bit of time. So there are some ways that you can help yourself remember. There's tape that you can use, and you can use it even during the day. You can absolutely use it at night, but that's a whole other conversation. And I do have a YouTube video on taping your mouth at night. If you're interested, there's a QR code right here. But Myotape, I love. Patrick McKeown made that or designed that. And I love that it goes around your lips instead of over. So you can still talk, eat, anything. There's nothing to keep you from opening your lips. And that's what I have on in this picture here. But it does remind your lips to close. So if you're watching TV or at the computer and you're used to kind of being like this, it'll remind you to keep them closed and sort of change your habit. There's also 3M Micropore Tape, which is also fantastic, very inexpensive. And you can just take a little piece and put it right here, and you can still breathe through the sides. You can put it this way, but you don't have to. To some people, that's a little bit too much. If your nose is obstructed, what's the problem? So if it's structural, and if you can go like this and it opens up your airway and you can breathe through your nose better, then you can try nasal dilators. Nasal dilator is a fantastic one because you can adjust the different sides differently. So if you have a deviated septum, you can make one size different from the other. The nasal dilator one next to it is kind of more for exercise, because you should be breathing through your nose during exercise as well. Obviously, at times, you're going to have to breathe through your mouth when you get really intense, but most of the time, you should be able to breathe through your nose. You also could use the Breathe Right strips, or you could see an ENT. If you have allergies, you can try eliminating the 3 Ds. And so those are the biggest culprits, which tend to be dust, dander, or dairy. You can see an allergist. Stop blowing your nose. It's counterintuitive, but as you blow your nose, you're creating more inflammation inside, and so it becomes this vicious cycle. So if you can use things like Xylitol nasal spray, which is a xylitol nasal spray, and it's fantastic. I use it with my kids and myself. And you can use that at least right before going to bed, but really as often as you need. You can use saline rinses like the neti pot. And then there's a nose clearing exercise that you can do that I learned through Oxygen Advantage, and I love it. So we can try this together, and don't worry, I can't see you. I only see myself moving my arms. But you would breathe in and out of your nose normally. And then as you breathe out of your nose, you're going to pinch your nose, and you're going to nod your head gently up and down as many times as you can until you feel like you have to take a breath. And then when you have to take a breath, you're going to let go of your nose, and you're going to breathe through your nose. And then you're going to breathe normally for about 30 seconds to a minute, and then you can try it again. And if you do have a stuffy nose, what it does is it starts to pool that nitric oxide in the nasal cavity, so that as you inhale, that molecule starts to open everything up and make it so that you can actually be able to breathe. So to breathe through your nose, you just need to start breathing through your nose. You also want to establish correct tongue posture. So if you put your tongue up to the roof of your mouth and you say, that's where you want that tongue to be. It's going to be right behind that incisive papilla. And if you put it there, though, you can open your mouth and you can still breathe through your mouth pretty easily. But if you make a tongue click, then as you suck that tongue up there, if you do that and try to breathe through your mouth at the same time, you pretty much can't. So you can try it. And it makes you breathe through your nose. So having correct tongue posture where the tongue is up, the lips are closed, and the teeth are lightly touching makes it easy to breathe through your nose because it's really the only way to do it. If we talk about functional breathing, the first thing is to breathe light. This is the biochemical part of things. So there's a gas exchange going on. There's oxygen and there's carbon dioxide. And in your blood, most of your oxygen is being carried by your red blood cells and hemoglobin, 98% of it. Only 2% of it is free flowing. If you're breathing too heavily, you are breathing off more carbon dioxide, and that changes the pH of the blood. Your body doesn't like that, and so it tries to accommodate. But what happens is that the oxygen is held on more tightly by the hemoglobin. So it doesn't let go of that oxygen to get it to where it needs to go in the body. So you're not as efficient at using that oxygen and getting it to where it needs to go. So you actually want to take lighter breaths. You can think of that like putting your finger under your nose. And when people start to think about their breathing, they tend to be really deliberate, and you start to hear their breathing. But you want to not hear your breathing. You want to try to almost not feel any air at all going in and out of your nose on your finger, and think of it like a feather. So trying not to move any of that feather. If you're breathing light, you can also think of this system. No engineer would ever think of a tube without thinking of what's going through it. So if there's a lot of airflow that's really heavy, you're going to be more taxing on the system, and it's going to be more likely to collapse, because in our upper airway, there's no bony structure. It's all just muscles, and there's actually 20 muscles within there. And so if everything collapses, then it's going to obviously be harder to breathe. So if we're not breathing as heavily, it's going to be less taxing on the system. The next part of functional breathing is flow. So this is your cadence, this is your flow rate. So if you breathe more slowly, you will decrease the turbulence of the air, making it less likely, again, for that airway to collapse. So the other part of it is that it's psychological. Slowing down your breathing activates the vagus nerve and triggers the parasympathetic response. And it makes you feel more resilient. So as you slow down your breathing, one of the things that, again, James Nestor said in that book, Breath, is that the ideal breath is 5.5 seconds. And it's just kind of easy to remember. So 5.5 seconds in, 5.5 seconds out, for a rate of 5.5 breaths per minute. So essentially 5 to 6 seconds in and out, roundabout figure. And if you slow your breath in that way, you're going to notice that you feel much more calm. In addition to that, if you prolong the exhale, or the time that you're breathing out, you're also going to trigger that parasympathetic rest and digest response. And that's the flip side of that sympathetic fight or flight response that if you're breathing rapidly, you'll have going on. So we can try this one together. This is one of my favorites, and I'll count for you. We're going to breathe in for 4 counts through our nose and out for 6 counts. And as you're doing it, if you can think of a string sort of pulling your head straight up to sit nice and tall, and we're going to try it. So you're going to breathe in, 2, 3, 4, and out, 2, 3, 4, 5, 6, and in, 2, 3, 4, and out, 2, 3, 4, 5, 6, and in, 2, 3, 4, and out, 2, 3, 4, 5, 6. And you can keep going, but essentially this is something where you're going to have stress in life. Things are going to come at you, and as they do, if you can keep yourself from hyperventilating, if you can control your breathing, you're going to feel much more resilient and able to respond to that stress as it comes up. The very last part of this is low breathing. So you want to have the biomechanical part of it, because these are the physical aspects of breathing. This is bringing your air down into the lungs to use that full lung capacity. You also, when you breathe with the diaphragm, which is your breathing muscle, you are triggering spinal stabilization, decreased tension, and vagus nerve activation. So with the spinal stabilization part, people who aren't breathing with their diaphragm sometimes will have more lower back pain. So you can think of this kind of like a jellyfish. So if you put your hands on the sides here, so right on the sides of your ribs, you can feel the bottom of your ribs there. And you think of a jellyfish. As you breathe in, your hands are going to go out. And as you breathe out, your hands are going to go in. So you should feel your hands go out as you breathe in and in as you breathe out, so that you're having that low breathing. So what can we do? You can breathe through your nose at all times. You can breathe light, slow, and low. You can learn some simple exercises to retrain your breathing. And we all have to breathe all day, every day. So there's plenty of opportunities. In fact, there's 20,000 opportunities to practice these things without anyone ever even noticing, because everyone's breathing. So if you can find ways to practice things, breathing throughout the day, you're going to be able to incorporate those with habits that you have, and it's going to be more likely to form a new habit. So sometimes I will, right before I eat, I will maybe like inhale and then hum or something as I exhale to trigger my rest and digest response. I'll focus on my breathing as I'm commuting to work, just trying to take different times in my day, because nobody can set aside 15 to 30 minutes to practice breathing. And then you just want to check in on your breathing many times a day. If you do it for like 90 seconds periodically throughout the day, you're going to see huge changes, and it's going to be much better than trying to carve out that time. So that's it. I'm sorry I ran over my 30 minutes, a few minutes, but if you want to learn more about simple breathing exercises that can fit even into the busiest lifestyle and promote lifestyle changes, you can certainly follow me on Instagram. You can contact me, and then hopefully we'll be forming some series coming up here soon. And so stay tuned for that. But at this point, I want to figure out how to unmute everyone, because I want to hear if anyone has any questions on that. And thank you so much for listening. Let's see. So I'm going to stop sharing my screen, because maybe then I can figure it out. There we go. And I'm going to try to unmute. Ask all to unmute. Okay.
Casey,
Hi.
I have a question. Can you clarify where your tongue is supposed to be in your mouth? Like if you're just, say, working on your computer, just that relaxed state, and where your teeth should be? Like, should your tips of your teeth be touching each other, or should your bottom teeth be behind your front teeth? Like when you're just sitting in a relaxed mode, you know?
Yeah. So the first part of the question, can you see this, Patty?
Mm-hmm.
So here's your top teeth, and there is a bump right behind your front teeth. So your tongue should not be touching your front teeth. There's a little bump called the incisive papilla, and that's where this first little sticker is. But then beyond that, we also want the rest of your tongue to be on the palate there. So if you think of your tongue sort of being up and arching right here, the reason is because it sort of brings that tongue up and out of the airway at the same time. Now, as far as your second part of the question with the teeth touching, that really depends on the bite, right? So people have different bites. We want the teeth to be together, but lightly touching, so that you're not clenching, but you're not necessarily apart, so that your lips can be closed. And ideally, so in adults, it's a little bit different, but especially in children, if the tongue is here and the lips are here around there, then it's equally balancing the muscle forces, because both are very strong. And so that kind of guides the teeth into the right place. Does that answer your question?
Yeah. So your resting tongue should almost be, it's that beginning of the click that you were talking about.
Absolutely.
So your resting tongue position should be right before you do the click. Okay. Perfect.
Because then you're training that muscle to be that way, so that you tone it. It's almost like lifting weights, right? And so that way, when you fall asleep, it'll be less likely to collapse, because you have more muscle tone too. Good question. Thanks, Patty. Yes. Is it
We have some,
Toya? Yeah, I've been doing Wim Hof breathing, and I just want to know what your thoughts are on that.
I think it's fantastic. I think that there are a lot of breathing methods, and they're all so many valuable things that go along with breath. For me personally, what I teach is just a little bit more, and conservative isn't the right word, but it's just functional, so that the training is more about how to breathe on a daily basis and just retraining. So for people, to bring awareness to it. So I think it's fantastic. And in fact, I'm not doing that, but I have Raynaud's phenomenon in my hands. So I've been training myself, and Bob's been helping me with that, with having the hands in the ice, then taking them out and then putting them in lukewarm water, so I can train my hands not to have that effect, to be able to kind of tolerate that, and doing my breathing exercises at the same time.
Awesome.
Yeah.
Thank you.
Mm-hmm. Any other questions? Oh, is there something in, let me see if there's anything in chat.
Oh, Tracy, actually, it's the question in the chat is the one that I asked. Just, I didn't know about petite women have a specific proclivity toward grinding. Did I get that wrong, or is that what you?
Do you mean when I was talking about the spectrum for the sleep disordered breathing?
Yeah.
In the RERAs. So what that is talking about is that there's something called upper airway resistance syndrome. And we tend to have, let me think of it. Respiratory, it's RERAs. Respiratory, I'm forgetting exactly what it stands for, but essentially, it tends to be more common in young fit females. It's not only in that, but it's the females who are, in their exercise clothes, they're coming to your office, they're just not feeling rested, they're very conscientious, they're kind of type A personality, but they're not getting restful sleep. And a lot of times the airway is smaller, and they're not stopping breathing. They're not true apneas where it's 10 seconds without breathing, but they will wake up because they're not breathing well, and then they'll kind of reset the body. So they never get into that deep sleep that you need, and that restful sleep. And it's kind of a frustrating thing for them to figure out, and just doesn't make any sense. And, that's, so it's also changed a little. I think that they've changed sort of how they look at hypopneas and apneas, and so it's being included a little more than it had been, but it's definitely a thing that's found that wasn't thought of for a while.
No, thank you. I didn't know, but that's helpful. Thank
Absolutely. You. Sure. Any other questions?
Dr. Jones, I'm trying to learn how to run while breathing only through my nose, but I feel like I get overwhelmed with carbon dioxide.
Sure.
Is that normal? Like, I have to train myself how to do that better?
Yeah, so I think that that you're probably going to have to slow down a little bit as you're starting it, right? And so depending on how fast you're going, you're going to want to breathe to handle whatever you're doing metabolically, right? So obviously the mouth is a bigger hole. And so if you need a ton of oxygen, you're going to be breathing it in through your mouth if you're sprinting, right? But if you're breathing through your nose, at first, your nose may run, and it's also smaller, so it could feel more stressful. So you may need to sort of train yourself, and that's certainly a lot of the oxygen advantage, what we talk about on how to do that training. But trying to basically go, you could start with maybe slowing down your pace a little bit to train yourself to do that. Make sure that you can absolutely, do the fast walk without breathing through your mouth, that sort of thing, and build back up to it. And once you get to the point where you are able to breathe through your nose instead of your mouth while exercising, you will be able to recover more quickly because there won't be as much lactic acid building up and things. So you'll notice that it's easier. You'll be filtering that air coming in, humidifying it. You can also, there's something, you could do some small breath holds as you start off to kind of warm yourself up, meaning that as you're warming up to start jogging, you can try taking like 10 to 15 paces after. So inhale, exhale, hold your nose and walk 10 to 15 paces. holding your breath, then let go of your nose, and that will start to basically change your tolerance for your carbon dioxide so that you're resetting that chemoreceptor. Does
Okay.
that make sense? Is that
Yeah,
helpful?
thanks. Yeah,
Mhm.
thank you.
Any other questions? Let's see, there might be some in the chat. I haven't looked. So let's see. Yes, it's me, Dr. Loud. Thank you, Dr. Loud. This was fantastic. Thank you for having me. I'm honored to be here. Okay, let's see. Oh no, did we lose the audio at some point? I'm sorry if I did. Anything else?
I have a practical question from,
Yes.
because now that we have you on board, right? We're all very excited, but people ask practical questions as how would that work? So, okay, so hypothetically, I have a patient that would be an excellent candidate for this type of breathing, right? So, and I tell them to, here is Dr. Jones' information. She's wonderful. I give them the whole spiel, but what specifically can they expect? So they call you, then what can we give them a little bit more info? You know, people, if it's an unknown, they like to know what they're getting into.
Oh, sure.
So, and I'm not talking about financially, I'm not worried about that, but it's more about the, you know, what can they expect? How long would that be? Are there different courses, that kind of thing?
Got it. So that can be tricky because just like any dental examination, every person is going to be a little bit different, right? And so the beauty is that Dr. Loud does such thorough exams and has so much valuable information that she can share with me that I know a lot of those things going in to talking with someone who happens to also be a patient of hers. But generally speaking, usually there's initial sort of consult, half hour or so, where I just get to sort of meet the patient or meet the person, see what their needs are, and kind of decide how to tailor that to them. So it may include the functional breathing exercises, but also I definitely believe that myofunctional therapy or oral, so I know you have a myofunctional therapist, and that is fantastic, but sometimes the exercises, the oral pharyngeal ones to strengthen those muscles and the tongue muscles especially, can all be part of it. And then, you know, is it someone who needs to learn to breathe through their nose instead of their mouth? And that's one thing. Is it someone who, just like me, I was not breathing functionally, and that's we didn't do the Bolt score, but it's a kind of a measure of where you're starting, and we want it to ideally be 25 seconds or longer that you can hold your breath without feeling the urge that you have to breathe. And I started off at 12 seconds. So I was that person who had asthma as a kid. I had allergies. I even had grand mal seizures as an infant that maybe was related to breathing too, depending on what you read. But there are a lot of things within my breathing. I was also finger sucker, you know, I had braces, all that sort of stuff. And so, you know, for me, I was mostly breathing through my nose, but I would find that during the day, there were times where, especially if I was concentrating, doing my dentistry, I would put my tongue in this certain position and open my mouth and start breathing through my mouth. And then I would end the day with this huge headache, and my breathing had changed just because of a habit that I had. And once I was able to correct that habit, you know, change how I was exercising, there's been some huge improvements, and even with my sleep as well, because I was also that person that woke up 3 times a night consistently. So
Okay.
I think it's establishing what they need.
Okay.
And then sometimes it's just maybe one meeting is enough so that they know the exercises that they need. Maybe it's a month, and maybe I usually set up exercises so they know how often to do them, what they're focusing on, because nobody wants to be overwhelmed. You know,
All this can be done virtually, right?
all of it can be done virtually. Absolutely.
Wonderful. Just making sure. And a question might be a stupid one, but there is no such thing as a stupid question.
Wow.
So we talk a lot about breathing through the nose, but the breathing out, does that have to be through the nose also, or can that actually go through the mouth?
Yeah, that depends on who you ask. If you're specifically talking about Patrick McCune and the Buteyko method, it's always in and out of the nose. And I find that just keeps it simple, because then you don't have to remember about one or the other. There are some people, and one of them's like Dr. Belfour, who does the homeo block. I've trained with him as well. He is really big on the exhale should be through the mouth. It should be with resistance, and it should be slow. So breathing in through the mouth and then.
Right.
with resistance and slowly. So there's so many different, I'm not claiming this is the only breathing method, but I do find that it keeps it simple to be able to just say, close your mouth, tongue to the roof of your mouth, breathe through your nose.
I just, was wondering, and then because I wrote down, but I don't have my light on, it's dark, I can't read. But so one other thing, we talked about children, children that have attention deficit. So where would parents start? Same thing, do a discovery call with you and then take it from there? That still all can be done virtually?
Yes, it still can all be done virtually. The exciting thing about children, though, that I can't do virtually is that if we want to expand them, if we want to do some early intervention, there are so many wonderful dentists out there, wherever you are located, whether it's Arizona or whatever, and maybe it's Dr. Loud, I can't speak specifically to that, but they can help expand and grow that child. But as they're doing that, we also want to make sure that they're establishing the functional breathing, they have that tongue in the right position, because everything can relapse. If if you have the tonsils removed, which if you have the tonsils removed and the adenoids removed, fine, maybe it needs to be done, and then the airway is more open. But if the nasal breathing isn't corrected, the tonsils can grow back. And if you correct the nasal breathing, sometimes those tonsils can shrink, and maybe you don't need to have them removed after all. So breathing can change a lot of things. But yes, it's so exciting, and you can start early. So there.
Let's say, what age do you?
Yeah. So I mean, even if you are a mother or whatever, if you're a parent and you have a baby and you notice that their mouths are open while they're sleeping, you can just close it and get them used to closing it. So that's simple early on. Breastfeeding is great, but I know there's a lot that goes into that. Kids that, are sucking their thumbs, there are habit correctors that we can use nowadays that kind of change so that they break that habit. But early on, 2 years old, we're starting earlier and earlier to help catch things, change things, grow things, because it's so exciting if you can catch it early.
Okay. All right.
Yeah. Anything else? I feel like I'm just not very good at reviewing these chats. So if I'm missing a question of yours, I would love, I'd love to do this for Berkshire Dentists. And let's see, anything else?
There's a person who can't unmute.
Yeah, so I don't know why that would be, Sarah. What do I recommend for allergies? That's a tough question. Depends on the person, depends on the allergies. One line of defense can be that the Xylitol nasal spray. I don't really know how to say that, but it's the Xylitol nasal spray that can help. I had allergy shots as a kid. It changed my life because I was on 2 allergy medications, 2 nasal sprays my whole childhood. And I asked my mom, can I please get allergy shots? Because I wanted to not be on that. And I was to the point where with cats, I couldn't even be around them without my eyes swelling shut, but now I can. And that was just from that therapy. And I think they can do it differently these days. So I'm not an allergist and I can't necessarily recommend. Can you try a meeting once again? Absolutely. Let me see. That's called me. Did that help? For whoever needed unmuting? Did that help?
Yes.
There. Hi.
I was the allergy question, so I have to go. Thank you so much.
Oh, you're
I hope that
welcome.
there's a recording. Thank you,
Thank
Anne.
you.
Thank you, Dr. Loud.
Bye.
Bye-bye.
Bye-bye. Thank you so much. Was there anyone else that had a question that was muted there for a while? Or did we cover it all?
I finally got unmuted. I've been trying for a while. This is Dr. Loud.
Oh, yeah. Hi.
I've been texting in like, someone unmute me, please. This is exciting. It was wonderful. Yeah, I just thought maybe it'd be a fun exercise to do the control pause with people and then kind of give them guidance on where they're at and what are the things that maybe they could start doing. And then maybe talk about what our next like monthly call could be about.
Sure. So let me do this. I had it on here, but I was really trying to keep this to 30 minutes. So I had taken it out. So depending on whether you're talking about oxygen advantage or whether you're talking about the Buteyko method, they're the same thing, but it's called the BOLT score, which is the body oxygen level test, or the controlled pause. And so it's a measurement to see how long it takes your body to respond to a lack of air. And it's not how long you can hold your breath. And it can be used as an objective measurement to not only see where you're starting, but to see, you know, how you're doing as you do exercises. So what you do is you, again, kind of sit up nice and straight. You pretend you have that string pulling your head straight up, and you're going to just breathe in and out of your nose normally. And, you know, it's kind of weird when you ask you to do it, because then you start to pay attention and all of that. So it's not a contest, not to see who can hold their breath the longest, but you're going to breathe in and out of your nose. And after you breathe out of your nose, you are going to pinch your nose and hold your breath until you feel the first urge to breathe. So that means that you might feel kind of like a flicker in your throat. You might feel kind of down in your chest here. It's just that urge, like, oh, I kind of need to breathe. And that's when you want to let go and take a normal breath through your nose. If you let go and you have to take a bigger breath and you held it too long, and you can just try again another time. But you can go ahead, if you have your cell phone by you, you can go to your stopwatch there. And I can't see everyone, so I wouldn't be very good at timing you, and I don't know enough about PowerPoint to actually make this run. So you would just want to breathe in and out of your nose, pinch your nose, start the stopwatch, and see what you get. So I'll give everyone a few seconds to do that. And then when you let go, you just take note of what yours was. And so here's the deal. If you are more than 25 seconds, then that's great. And you probably, there's an 89% chance that your breathing is already functional. Could you improve it? Absolutely. But that probably means that you're breathing functionally during the day. You're probably doing well at night, and that's fantastic. If it's less than 25 seconds, you're usually having some faster, harder upper chest breathing. And that doesn't mean that you're necessarily something you notice, but you're breathing more rapidly. 30 seconds of faster, harder breathing can lower the carbon dioxide in your blood by 50%. And it has the effect of reducing blood flow to the brain by up to 40%. So as we work on this, you want to see that control pause or BOLT score improving. And as it improves by every 5 seconds or so, you will feel different. You'll feel often more rested. You'll just feel more resilient. And so it's kind of a great thing that you can do essentially every morning. Right after you wake up, you can test it and see where you're at. So hopefully that helped. I don't know if everybody did that. Let me see if I can stop sharing my screen. No, don't want to do that. Hold on, stop. Yeah, stop share. That's what I want. Okay. So yeah, so does anyone want to share where they, like I said, mine was 12 seconds to start. So does anyone want to share where they started or what they got?
I was about 12 seconds.
Yeah. Yeah. So what that means is that you're just not very tolerant to the carbon dioxide building up. You're very sensitive to changes in carbon dioxide, because it's not the lack of oxygen that makes us feel like we have to breathe. It's actually the buildup of the carbon dioxide. And so if you're able to sort of change that tolerance to it, it can help with your breathing to be more functional. And so there's breathing exercises that can be done, like breath holds. One of my favorites that's real easy, we can all do together, is just the small breath hold. So you, again, are breathing in and out of your nose normally, and then you, after breathing out, would either pinch your nose or just hold your breath for 3 to 5 seconds, depending on what your BOLT score is, because you never want to hold your breath for longer than what half of your BOLT score is. So if your BOLT, and some people with COVID have really low BOLT scores, and so need to work on our breathing again. But if we create too much stress by holding our breath too long, then it can be counterproductive. So you need to be gentle. And so you would breathe in and out of your nose, and you would hold it for 5, 4, 3, 2, 1. Then you're going to breathe in and out of your nose normally for about 10 to 15 seconds. And then you're going to breathe in and breathe out and hold your breath for 5, 4, 3, 2, 1, and then breathe normally again, in and out. Good. You're going to take a normal breath in and a normal breath out. You're going to hold your breath for 5, 4, 3, 2, 1. You're going to breathe normally again. And something that was really hard for me, we'll do it again. So you're going to take a normal breath in and a normal breath out, and you're going to be 5, 4, 3, 2, 1. And this one is really meant to kind of just reset yourself, right? If you're faced with some stress, if something is just caught you off guard and you need to just take a second to reset, you can do this anytime. You can just do those small breath holds and it just sort of calms you down. Something that was really hard for me to understand and grasp, because I'm a dancer, so I'm all about big, right? And so when you think about breathing in this way with Buteyko or Oxygen Advantage, it's all about breathing less, which is so counterintuitive. And so when I focus on something, I want to work on it really hard. And so I want to be hearing my breathing. I want to be seeing it. And it's not about that. It's about, taking in less air. It's almost like an air diet. So you want to be, again, kind of resetting things. You want to essentially get to the point where you can't hear your breathing. The people next to you can't hear your breathing. And it's just a really subtle, relaxed thing. We're kind of in the zone. So Dr. Lau, did that help a little? So let's think. You also asked me what other topics we could do. And I would say that I'm open for suggestions, but obviously if people are interested, there's the whole child side of things, because sleep disordered breathing and things that we can do in children does look a little bit different. So instead of kids being exhausted all the time, they're often bouncing off the walls to try to stay awake. And so a lot of times they may be misdiagnosed with ADHD when they actually are having sleep disordered breathing. And kids aren't necessarily stopping breathing while they're sleeping, but you may hear them kind of breathing noisily. You may see them wetting the bed. There's a lot of other things with children. It could also be some of the exercises themselves. It could be talking about some of the exercises that can be done to help strengthen the muscles of the tongue and the oropharyngeal sort of exercises, which are a little different from myofunctional exercises. It could be talking about the exercise side of things. So for those who may already be functionally breathing and want to know about how to improve their performance, their athletic performance.
Dr. Loud cannot unmute again. So.
Oh no, well see, that's my fault. I have no idea what I'm doing wrong. Let me try again.
I'm thinking, Dr. Jones, we have plenty of time. We're going to do this once a month, right?
Yes. Yeah.
Okay.
I think a good topic, and I saw somebody ask the question. Yeah, you unmuted me. Someone asked the question in the chat, how can you cure or reverse sleep apnea with this? And I think that would be a good topic for maybe next time, because there's a lot to talk about there. That's one of the things that so many people are dealing with. And I see a lot of mild and moderate sleep apnea.
Yes.
And I think that would be a really good topic next time.
I would love to do that. There's actually 4 different phenotypes of obstructive sleep apnea. And so we used to always think it was structural, but only one of them, which is related to the P crit, or the pressure where everything actually collapses, is related more to structure. There's other things that have nothing to do with that, like the high loop gain, the upper airway recruitment, and the arousal threshold, which have to do with your carbon dioxide sensitivity, with how quick you are to wake up, and how able you are to recruit your muscles that have a role too. And so sometimes those things can't be influenced by the traditional methods of treating sleep apnea, but they can be influenced by breath retraining and training the muscles to get stronger. I'm not saying that you can cure all sleep apnea or that it should replace anything, but I do think that it can play a huge role and can help, because as simple as if you can't breathe through your nose, again, the CPAP's going to be less effective or able to be tolerated when you're breathing through your mouth, because all that air gushing in is just harder. You can't humidify it in any way or warm it up. And so there's a lot there. I think that would be a great talk. I would love to. Anybody else?
Thank you so much. It was a wonderful presentation. It was amazing.
Oh, thank you so much for having me. I'm so excited to do this. Truly honored to get the opportunity. So thank you so much.
Okay, so are there any other questions for Dr. Jones? I'm looking at the chat room. Perhaps next time, Dr. Jones, I can help you out by being your chat monitor and give you.
That'd be amazing.
And teach you the questions when they come up. That might be good.
I'll take it. Yes.
Lots of
I can get.
Lots of good feedback. So beautiful.
Yeah. There's one more. Mm-hmm.
Well, I look forward to next month.
Yeah.
Well, thank you.
Me too. Okay.
All right. That was fantastic. Thank you, everyone.
Thank
Have
you.
a wonderful night. Don't forget to smile and dance.
All right. Thank you, Dr. Jones.
Take care.
Bye.
Thank you.
Bye-bye. Bye. Hi. Thanks for coming. Thank you.
It is. It was wonderful. It was really good. It was really good.
Thank you. That was so much fun. Thank you for having me.
I'm totally in the dark. I just see that now. I'm looking at myself and I'm like,
I know. And you know what, Anne? I have
it's like Halloween. It's like Halloween.
I'll be interested. I should stop recording now. Hold on.
Yeah. Yes, please.
Already. Okay, stop recording.
Okay.
Are you sure you want to